Dr. Dow, I'm curious, is the vaccine safe for pregnant people?
So it is recommended, and yes, you should check with your healthcare provider for pregnant women to get vaccinated.
And if I can just share my personal experience, I'm pregnant and I decided to get the vaccine, both to protect myself and to protect my baby. And I'm happy to say that I and my baby are doing great.
That's fabulous, Megan. Congratulations.
Wonderful, wonderful.
Dr. Dow, is the vaccine halal?
The answer is yes. And this is based on the scholars from the Sunni and the Shia leaders. And they also call it fatwa, that this is law, ruling law, that it is halal. There's no animal products, no gelatin in any of these vaccines that we have. The mRNA vaccines, Moderna, Pfizer, nor Johnson & Johnson, and nor AstraZeneca, if that gets EUA approval in the United States. Something else that's also interesting when I was doing my research on this is that the laws also say that you can take the vaccine during the holy days, like Ramadan, which is about to come up. So they say that getting the vaccine is the highest form of saving a life, your own as well as others.
That's great to hear. And Dr. Alexander, could you wrap us up by telling us what should people do after they get the vaccine? Why is it important for me to still wear a mask, for example?
I think we talked a little bit about that earlier, but clearly if you've not been vaccinated, and even if you've had coronavirus, the possibility of shedding virus, of getting a variant, it is there. And also once vaccinated, it would be 6 weeks, so that you definitely for the first 6 weeks need to continue to wear the mask, maintain distance, do things outdoors as much as possible. But it is also not clear in our research that once vaccinated, you could not necessarily get a variant, be asymptomatic, and then spread that variant. And again, we talked earlier, I mean, if you are a child, you would feel terrible if you brought home this particular virus and you infected a mom or a dad or a grandparent, or even your child. So the ability to spread this virus publicly is a huge concern. And we know it's very contagious. It spreads very easily across the globe, all ages. And therefore, we are strongly recommending right now, continue to wear the mask. That is the best protection. Distance from others physically when you can, and do things outdoors because, again, this sort of decreases the risk. CDC right now is also recommending that we not travel. I know a lot of people have been traveling. A lot of young people have been traveling for spring break. And we do worry that, you know, if you're not wearing the mask and distancing, you can come back and give us another wave of this virus, which we would like not to have.
And what I usually tell my patients after vaccination is, yes, be cautious, but you don't have to be fearful.
And it is also important to note for people who have been vaccinated for 6 weeks, like Dr. Dow and myself, you can get together with other vaccinated people, and that should be safe. But again, if you're in a population and you don't know who's been vaccinated or not, we ask that you still use precaution to protect them.
Thank you, that's great advice. And I'll continue to wear my mask when I'm out in public. I'm getting my second shot this afternoon, and will continue to wear my mask.
We definitely appreciate that, Megan.
Dr. Dow and Dr. Alexander, thank you so much for spending the time with me today, and thank you for answering these really important questions. To those who are watching, to see translated information about the coronavirus vaccine, including answers to more frequently asked questions, visit the Center for Disease Control's website at www.cdc.gov. Goodbye.
Goodbye.
Bye.